right, well, thank you very much, Donna. I appreciate your time. I cannot wait to show the people of Fairfield and Sydney Southwest and whoever else is listening about our services. The aged care and disability service that we do provide, the team, is fantastic. I love the multiculturalism and the real understanding of culture that you guys bring to care. But for everyone who doesn't know you, can you please introduce yourself and the service you work for?
Okay, hello everyone. My name is Donna. I'm the Senior Program Manager for Core Community Services Aged and Disability Care Program. So we are an approved provider for the National Disability Insurance Scheme, the Home Care Package Program and the Commonwealth Home Support Program. For over 40 years, ADC, Aged and Disability Care, has been integral to the local community, proudly and respectfully delivering accessible, high-quality services for older people and more recently extending our disability program to children and young people. As an organisation, we are proud of our inclusive and welcoming culture. We are a drop-in centre for the community as a whole, and every individual we engage is treated with dignity and respect, with their identity, culture and their diversity valued.
That sounds fantastic. Now, you mentioned 3 different packages of services.
Yes.
I kind of have an understanding. You have a good understanding, or way better understanding than me, but a lot of people in the community don't really understand the difference between like CHSAP or those acronyms and like the disability services. Can you just give a real short, for my understanding and people that might not know it, what are the differences between them?
Okay, so our disability program focuses on building capacity to manage day-to-day life through the development of knowledge, skills and networks of support. Our disability program supports people from all ages, children through to older years, who have an NDIS plan. So some of the supports and services we provide are support coordination. So that's assisting participants to understand their NDIS plan, connect, coordinate, implement and monitor their NDIS plan. Assistance with activities of everyday living, social and community participation, group programs for children, young people, teenagers and adults, and therapy support such as occupational therapy. We work with participants and their support network to develop a plan of support to provide the tools they need to live a more independent, active and social life. Then we have our aged care program, which delivers the home care package program and the Commonwealth Home Support Program. These programs support people over the age of 65. Our range of aged care services provide consumers with the skills and knowledge to stay active and healthy, explore their creativity and maintain independence to live at home confidently and happily. Our services support a wellness approach that builds on the existing strengths, capacity and goals of our consumers. So the Home Care Package program delivers a variety of services from personal care, domestic assistance, so support with household domestic chores, allied health, clinical care and nursing care. We have our own registered nurse and can do telehealth appointments, meal preparation, including shopping, social support, community access, transport to personal and medical appointments. Also support with services relating to mobility, continence management, assistive technology and equipment. And we also have a home modifications and home maintenance program. They can do big, small jobs as well as garden care. Then you've got the Commonwealth Home Support Program, which delivers social support group programs. So we run centre-based and community access programs, in-home support such as your domestic assistance, meal preparation, personal care, the same as your individual social support, community access, transport services, and a range of accompanied activities to help you maintain your independence, as well as access to our home modifications and home maintenance program. Now, the last service that we also can offer is private services. So this is a personalised service to individuals at a cost that is affordable. Supports can be provided in their home and community, but also aged care consumers in receipt of a home care package with another provider can purchase our supports and services paid by their home care package.
Oh, awesome. So you guys offer Well, so much. It's crazy to think. And the fact that you're offering not just, in-house in-house groups, but you're also taking it out to the community for your aged care is fantastic. Because one of the biggest things that we did hear about the during like the lockdown and is the isolation, is the not being around people, and especially I'm sure I may be wrong about this, but there's research behind the whole, as people get older, they become more and more isolated. So getting people together is absolutely amazing. And the fact that your NDIS program or your disability program, caters from, young to old is just phenomenal. So if you're I'll give you two scenarios. So about how people can get in contact with you. So let's just say if I've got a young family. One of the kids has a developmental and intellectual disability. How would I get in contact with you? And once that contact's made, what happens from there?
Yeah. Okay. So, I think importantly, what I would like to highlight is here at ADC, we value diversity and inclusiveness. Our workforce is representative of the cultural diversity of our area, demonstrating an ethos of inclusion and true partnering with our clients and the community in the planning and delivery of your services. Also, too, I think it's important to highlight that we ensure each person, whether that is working with a person with a disability or our aged care clients, that each individual is supported to exercise choice and independence, including to make decisions about their own support and care and the way care and services is delivered. We ensure that each person is able to make decisions about when family, friends, carers or others should be involved in their care, communicate their decisions, make connections with others and maintain relationships of choice. And I'm confident that our team is skilled and capable to support anyone that comes, whether through our doors, picks up the phone and talks to us, and I'm confident that we can meet your needs. And if you would like to find out more about our services, you are welcome to come to our centre located at 22 Nelson Street in Fairfield, or you can call us on 8717 1500, or you can also email us at info@corecs.org.au. And I'm sure, Jose, that you can also put our details up here as well. But if you call through, you can ask to speak to someone in our aged care program or our disability program. You may also get me, and I can have a chat to you about how our service can support you to help you live your best life, whatever that may look like.
That's awesome. That's really good. So if they are going to call you up, is there a minimum kind of we'll start with the NDIS. Is there a minimum kind of information that they need to have? Or if they've just got general questions, can they bring you up and then you can talk through the process about how they get onto your books?
Look, we welcome any calls. There is no question that is a silly question. So if you just have a general question and want to find out what services we offer, call up and ask. If you're not even sure whether your loved person or yourself is eligible for the NDIS, I'm also happy to share information about how to apply for the NDIS, and the same with aged care. I'm happy to provide information that's general, or if you have specific questions, feel free to give us a call and we will do our best to be able to answer your questions. If in the event that you do ask a question that we don't know, we can find out and then get back to you and provide the answers to your questions.
That's fantastic, because I know a lot of people who do ask myself or just in general community be like, I want to get involved, or we need this help, but we don't know where to start. They might have been turned away because they don't have specific paperwork or details. But for the community to be able to ring you up and be like, I need help, how can I get there? It's fantastic. Now, that's it. Thank you very much. I just want to say a big congratulations through the work that you guys did last year. I think when I've added it up, you did like over 41,000 hours worth of care. during that 2021, which was absolutely insane. And when I've added it up, that's like nearly 4.5 years worth of care in like total, which during the pandemic and the isolation and the lockdown in Sydney Southwest, that work was absolutely amazing. But congratulations again. Thank you for joining me. And that's it.
Thank you.